Hello guys, hello friends. Welcome to my channel. This is This Farmer YouTube channel. Today, I'll be discussing the topic cholesterol. Cholesterol is a waxy substance in the blood and cells. Cholesterol is produced in the liver. It can also come from dietary sources. Today, we'll be discussing the types of cholesterol in the body, the importance of cholesterol, the health effects due to an imbalance in cholesterol level, the factors that could raise the level of cholesterol in the body, what can be done to reduce the level of cholesterol in the body. Cholesterol is a waxy substance in the blood and cells. Cholesterol is produced in the liver. It can also come from dietary sources, majorly from animal-based dietary sources such as egg, kidney, liver. The importance of cholesterol in the body: it is used for the formation of cell membrane. Cholesterol is also used for the formation, or you can say the synthesis, of the steroid hormones such as cortisol, which is a hormone that helps in immune response. It's also the stress hormone. Cholesterol is also used in the production or synthesis of estrogen and testosterone. It should also be known that cholesterol is needed for the production of bile acid, which is used for the digestion of fat. In the body, fat is emulsified into lipids, which are later absorbed into the intestine. The lipids are then deposited in the liver and body tissues. It's in the liver that the liver cells turn these lipids into lipoproteins. Lipoproteins then move into the bloodstream. Lipoproteins are made up of lipids like cholesterol, triglycerides, and proteins in various proportions. It is due to these various proportions of these components of lipoproteins that different lipoproteins have different densities. Now, let's talk about the types of cholesterol. Basically, we have two types of cholesterol. The first one is a low-density lipoprotein, which we call the bad cholesterol, because this cholesterol is implicated in cardiovascular issues. Then you have the high-density cholesterol, which is a good cholesterol. The low-density lipoprotein, that's LDL, is considered the bad cholesterol. It's of two types: the large buoyant LDL and the small dense LDL. LDL accumulates on the walls of the blood vessels, causing inflammation. This inflammatory response triggers macrophages. Macrophages are types of white blood cells, and we all know what white blood cell does in the body. White blood cells help to protect the body against pathogens. Now, when there is inflammation, the macrophages move to the site of these inflammations to remove the low-density lipoprotein. Much accumulation of the low density lipoprotein on the walls of these blood vessels lead to the movement of more macrophages to the site of the buildup. These macrophages begin to absorb this LDL. But it should be known that there is a buildup of LDL, and later this buildup will overwhelm the macrophages, and this leads to a buildup of fibrous materials. This buildup of fibrous materials later obstructs and narrow the arteries, and this in turn reduces the flow of blood through these arteries. LDL, as I earlier on said, is a bad cholesterol because it is implicated in cardiovascular diseases and conditions. Now, the high density lipoprotein, the HDL, it is considered the good cholesterol. It helps to remove excess cholesterol. Basically, it helps to remove the low density lipoprotein from the cells and the arteries and return them to the liver for excretion. This helps to remove or reduce the risk of formation of plaques. When plaques form on the arteries and the blood vessels, they raise or increase the risk of cardiovascular issues. HDL is anti-inflammatory in nature. It helps to regulate and checkmate the level of the low density lipoprotein. All lipoproteins are essential for the body because they have vital roles and functions in the body. As I said, they are used for the synthesis of some hormones and enzymes. But the levels of these lipoproteins become dangerous. The lipoproteins become dangerous to the body when their level go out of balance. Now, the tests used to monitor or regulate or assess the level of lipoprotein in the body is called the lipid panel. The lipid panel is a blood test. It simply measures the total cholesterol level. It also gives the level of low density lipoprotein, the high density lipoprotein, and the triglycerides. Lipid panel is simply used to assess the risk of heart diseases. And as I also said, it's used for monitoring cholesterol level. There are important points I want you to note here. They include these, and they are very important you know them. These are lifestyle and diet could affect the level of cholesterol in the body. Cholesterol level, especially the low density lipoprotein, increases in the body for people who smoke. Exercises and aerobic activities lowers the level of low density lipoprotein, which is the bad cholesterol, and increases the level of high density lipoprotein, which is a good cholesterol in the body. Consumption of unsaturated fats, typically from plants, could help to reduce the low density lipoprotein, which is the bad cholesterol. Example, nuts, seeds, avocados. Also, fishes like mackerel, sardine are rich in unsaturated fats. It's also noteworthy to note that intake of food rich in fiber help to reduce LDL level. Examples of such food include fruits, vegetables, whole grain. Fibers achieve this result. How? How do fibers reduce the level of low density lipoprotein in the body? Fibers will bind to the bile acid in the gut, and this causes the body to use cholesterol to make more bile acid. And this helps to bring about the reduction in the level of cholesterol in the body. I want you to also know that excessive intake of alcohol raises the level of triglycerides, and possibly this could impact the level of low density lipoprotein in the body. There are drugs called statins. These drugs help to reduce the level of cholesterol in the body. Example of statins, we have atorvastatin. How does this drug reduce the level of cholesterol in the body? They simply block an enzyme called HMG-CoA reductase. This is a principal enzyme required to produce a low density lipoprotein. Also, medications could help to lower cholesterol by increasing the production of enzymes that help to break down the triglycerides. And also, medications that help to lower cholesterol in the body can also enhance the low density lipoprotein receptor activities. The enhancement of these LDL receptor activities will simply lead to more uptake of low density lipoprotein into the cells from the blood. Thus, they are leaving the blood into the cell, and this brings about the reduction in the level of low density lipoprotein. Thanks for listening. Make sure you subscribe to my channel, like and hit the notification button to be notified anytime we have a fresh video. Thank you for listening.